started a study we did a few months ago on this is within a campus. ALL is a network that we set up in Italy. Well, quite a number of years ago, I think about 6 years ago, we decided to set up a network of active people working in ALL in Italy. So it's about 50 or 60 centers of people. And to add to this, that worked very well. So we extended this to a campus in CLL and a campus in chronic myeloid leukemia too. So we have, in fact, 3 active campuses in Italy. And they're active because they work, and it's mainly younger generation that are moving forward in that direction. And they presented at major congresses, orally at ASH and papers too. One is the one you mentioned that was published in Hematologica a few months ago. That would be Daratumumab anti-CD38. There was some hint that it may work also in ALL. So we did this in patients who'd relapsed, were refractory, so they didn't have any, any other therapeutic option actually. And so we saw some degree of response. I don't want to be at all enthusiastic, but there was some degree of response, particularly, I would say, in 2 situations. One, in patients with limited disease. If you have a full-blown disease, the results were by no way encouraging. A few patients, it's a limited and multi-center retrospective, so with all the limits of that. But having said that, patients with limited disease did show evidence of response, so they could maybe go to further treatment. And possibly where there might be more activity in TLL than in B lineage ALL. So very preliminary, I wouldn't like to, stick my neck too far. We would like to do a study on this aspect, but we're still in discussion. And I think there's study going somewhere. So it's preliminary, but of some interest.